All right, guys, and welcome. The purpose of this video is to answer the question of what are the low thyroid function symptoms in women? And I can assure you at the end of this short video, you are going to have a really good idea if your clinical presentations are associated with hypothyroidism. And don't be surprised if many of you have what maybe your provider has said are normal thyroid function labs. Because I want you at this point to sort of separate out the clinical symptoms that we're going to go over in this video with what you've been told is a normal lab. Because I can tell you, having worked with thousands and thousands of women, that these don't necessarily correlate. And who am I? My name is Scott Resnick. I'm a medical doctor who believes that the future of medicine is in videos like this, empowering individuals like yourselves to become best stewards of your own healthcare, to make good choices, understand your testing, and ultimately make choices of health over disease using natural approaches and avoiding pharmaceutical drugs. What I'm going to do is give you 5 different categories in the order of commonality of what I've seen in my 25-year history of working with women to optimize their thyroid function. The first category will be probably what I see most commonly, and then the last will be the last. And what we're going to do is we're going to do a quick little set of scoring over the next 5 categories. So be sure to stick around to the end of this video because you're going to have a good idea whether clinically you fall into a state of hypothyroidism. So grab a pen, grab a piece of paper, open up an app on your phone, and we'll get started. Okay. Number 1 low thyroid function is probably feeling cold. Now, this might be that you feel like you need to put on a sweater when other people are just wearing t-shirts. Maybe you feel like you need to have on gloves or an extra pair of socks when your friends are wearing flip-flops. And you're gonna have a sensation that you're just a little more cold. And one of the most common complaints I heard was not from women like yourselves, but from their bed partners who noticed that they had cold hands and cold feet. So if you're always throwing on a sweater because you're cold, you have cold hands and cold feet, give yourself a 4 or a 5 on the checklist, and we'll move on to number 2, which is fatigue. So probably the second most common complaint that I have heard is one of fatigue. Now, this may not be profound fatigue. I mean, you're still able to go to work and take care of your kids and stuff like that, but you're just not feeling quite as energetic. Why is this? It's because thyroid hormone sets the metabolism of each of our 10 trillion cells in our body. And when our thyroid hormone function is working well, we can burn our engines a little hotter. Now, thyroid is kind of like our hibernation hormone, and as you will learn in other videos, when we're under a lot of stress, when we're inflamed, when we're infected, our body defaults to a low thyroid function. So if you're feeling fatigue, if you're feeling like it's hard to get out of bed in the morning, you need that extra cup of coffee, or maybe mid-afternoon you get that slump and you're looking for the break room where you're sure that somebody left a little plate of some cookies. These are all signs that are associated with hypothyroidism. So number 3, which in some women, maybe I would put as actually number 1, is dry hair and dry skin. So what do I mean? Women notice when their hair isn't as lustrous, it's not as full, it doesn't have that bounce. Maybe you're losing more hair. Another really common sign of profound hypothyroidism is loss of the eyebrows in the lateral third. And I can't tell you how many women I've asked the question of, are you losing the lateral third of your eyebrows? And they go, look, doc, I'm penciling these in. Other women notice changes in their skin and their nails at their fingers. So when I mean skin, I mean more friable cuticles, more cracking, maybe some occasional bleeding. A number of women have told me that it was their nail technician who noticed that their nails were more brittle or weren't quite as healthy or growing more slowly. So think about that on a scale of 1 to 5. Where are you with your hair and your nails? If you're missing your outer third of your eyebrows, give yourself a 5. Okay, the next category of these 4 is constipation. And the vast number of women who are struggling with hypothyroidism are also struggling with constipation. So a normal stool function in a healthy person is having at least 1, if not 2 bowel movements a day. So if you are going for 2 days, 3 days, 4 days or more without having a bowel movement, that is a very strong sign of hypothyroidism. Give yourself a 4 or a 5 on that list. And the last symptom that I've seen in my history of working with a number of women are mood changes. And typically this is depression, but it can often be associated with anxiety as well. So if you notice that your mood is a little down, you're feeling a little more blue, a little less peppy, and maybe you could be suffering from some additional anxiety as well, these could all be due to a state of hypothyroidism. So depending on the severity of your symptoms, give yourself a 3 or a 4 or a 5 on this particular category. Okay, now we're gonna add up the 5 previous categories. And I can tell you that if you scored greater than 15, you are suffering from some degree of hypothyroidism. If you are between 20 and 25, get yourself to your doctor right away because you are gonna feel so much better once you get on some thyroid hormone. And this brings up one more comment, and this is that if you are profoundly hypothyroid, don't cuck around with using iodine and selenium and taking tyrosine and all these other, herbal products. Get on some thyroid hormone. You're gonna feel so much better. As always, I'm making these videos to empower you guys to be best stewards of your own healthcare, to make good healthcare decisions, to turn around all aspects of your health when mainstream medicine has failed. As this is YouTube, I am almost obliged to say be sure to subscribe, like, leave a comment. Most importantly, you can share this video with your friends. You can help to spread the word because we are building a grassroots movement to empower people like yourselves to really make good health decisions based in science, based in good practice, based in good protocols to start to feel better, live longer, and just feel great. Whew. All right, you guys, this has been great. I will see you as always in another video, and take care.